Hello and welcome to the Living with Trauma series. I'm Dr. Frank Drummond, National Medical Director with HCA Healthcare. And this is the Living with Trauma podcast series in honor of Trauma Month about people living with and working with trauma and its effects on individuals and families. I have the pleasure of being joined today by Erika Roberge, a PTSD and DBT team clinical psychologist at the Salt Lake City Veterans Administration Medical Center. She's also an adjunct professor at the Department of Psychiatry at the University of Utah School of Medicine. Welcome, Erika.
Good morning. Thank you for having me.
Let's start with some basics. Can you help us define post-traumatic stress disorder?
Sure. So post-traumatic stress disorder, or PTSD, this is one of several reactions that people can have after experiencing a traumatic event. And we would consider an event to be traumatic when someone experiences or witnesses death, serious injury, or sexual violence. And while people can have quite a few different reactions to experiences like that, people with PTSD find themselves re-experiencing that memory or that event. This could be through nightmares or while they're awake, suddenly thinking about it again. They do everything they can to avoid thinking about it or remembering what happened. They also tend to develop symptoms that look a lot like depression. So, withdrawing from friends and family members, being less interested in activities that they used to enjoy, feeling a lot of bad feelings, but not really feeling very many good feelings. And last but not least, they also find themselves chronically on edge. So, kind of always in this high stress state, worried that something else bad may happen and trying to be prepared for that thing. And while this is one of the reactions to trauma, it's also not the most common. Probably about 13% of people on average will experience these symptoms after experiencing a traumatic event.
Thank you. I think it's interesting. Some of the things that are kind of clear are, okay, you experience a really bad or traumatic event and you remember it and you have memories that are hard to deal with. Those are the obvious ones. There is some damage that happens psychologically and physically that does cause symptoms beyond just remembering.
Yeah,
Like you said, the increased startle, which is very prominent, um, some of the reactivity, and then some of the mood symptoms that can really just go on and exist independently. These symptoms can go on for a long time. Is that right?
they really can. So while these reactions to a traumatic event are actually they're normal in some respects. Most people will find themselves thinking about what happened. They'll not want to think about it because it's painful. They'll have painful reactions like that depression and that hyperarousal. While those things are normal, we consider those reactions to become PTSD when they last for more than several weeks, so more than a month, but unfortunately, more often, we're talking about several years. But also, those symptoms start to become significantly impairing in people's lives. So, having an impact on their relationships, on their work at home, school, actually in their workplace, in other areas of their lives.
So let's drill down on that a little bit. So how would that affect their work, for example? What examples have you seen?
Yeah, so I think one of the most common ways that I see it affect people's work is often trauma disrupts people's beliefs about their ability to trust other people or to relinquish control. So, especially if someone is not in a position of control at work, they might find themselves on edge or concerned that their supervisors or superiors might make decisions that jeopardize their safety or well being if they thought that in their traumatic experience that had happened before. So that tends to be pretty common. Also, a pretty common experience of people with PTSD is they find themselves chronically on edge. And, just like anybody else, if you're chronically stressed, you also tend to be more irritable. So issues at work can get a little bit more blown up, and maybe we snap at people at work more than we would our friends and family members.
And it can be literally exhausting to carry this burden also, right? Like they're tired.
It is exhausting, and I think that's also where the anger and the irritability can come from. If you are always on edge, that not only depletes your emotional resources, but just your actual physical energy. And then when we consider that almost everyone with PTSD also has insomnia, so they're on top of that not sleeping, it just really becomes a perfect storm for having a lot of other problems go on.
I've worked with many people where the nightmares are a prominent symptom,
Yeah,
the nightmare and flashback category, and they literally refuse to go to sleep just because of the nightmares. That happens to a certain subset of people experiencing this also.
definitely.
Can you, so let's talk about kind of the history of post-traumatic stress disorder. Why has post-traumatic stress disorder historically been so difficult to treat, in your opinion?
Despite PTSD realistically having existed and been an issue people have had for centuries, we actually did not have a way to define this set of problems until 1980. And if we think about that timeline, 1980 is even post the Vietnam War, um, and obviously post World War I and II. So we're talking about hundreds of thousands of people who likely experienced these symptoms, but their doctors, their friends, their family members didn't know what to call it, and they didn't know what to do with it. But once we did finally come up with a name for PTSD, we were able to start developing some treatments. And it's really been since the early 90s that we have seen the invention and implementation of evidence based therapies for PTSD. And they have, in the last 30 years, really grown exponentially in the number of therapists who are trained to provide these treatments. But before they were available, it was up to an individual clinician to try to figure out what to do with this person's presenting problems. And unfortunately, if that clinician's inclinations didn't include some elements of exposure therapy or what we call cognitive restructuring, which are the elements that we know make PTSD treatments effective, then those treatments were not likely to work. And unfortunately, before these treatments became more popular, most people were put into kind of like support groups, which may have had some kind of place in the healing process, but they don't address the symptoms of PTSD. And so, in addition to that, unlike a lot of other medical or a lot of other mental disorders, we don't really have good medications to treat PTSD. Currently, there's only two with some sufficient evidence base for treating PTSD, but those don't even have the same level recommendation as the evidence-based psychotherapies, which that can also lead into a problem of, are there people in my area who are trained in these psychotherapies? So it went from us not knowing what the problem was to not knowing how to treat it. And then the problem that's been more recently addressed, or is being addressed rather, is getting enough providers trained to provide the treatments to people regardless of where they live.
Speaking of veterans, which I know you do a lot of work with, do you have a figure about the percentage of veterans that have some level of PTSD?
Yeah, so it really varies by era. Vietnam veterans were estimated to have rates of PTSD in the high 20%. For our more recent veterans from the OIF, OEF, OND eras, the estimates vary from around 13 to 20%. And while that's a somewhat big estimate, it is certainly much more common in veterans than in civilians.
That is a lot of people too.
It is. When you
For
think
the,
about it, it's maybe
Mhm.
1 in 5
That's big.
veterans.
That's big numbers.
Yeah.
Let's pull back. So let's say recognize I've experienced a significant trauma in my life. I'm unhappy. I'm having symptoms that are affecting my work effectiveness or ability to hold a job, and my family is becoming distant and complaining about my behavior. It's time to get help. What happens
Yeah.
when I show up at a VA and ask for help?
Yeah. So there will be some different procedures depending on which hospital you come to, but it'll always start with an assessment to confirm that PTSD is indeed the right diagnosis. If it's not, we would want to refer you for another treatment. But if you do have PTSD, then what we want to do is go over your treatment options, because there are actually several empirically supported or therapies that are backed by research and science. We have a couple that we know work really well. And another cool thing is we know that they work just as well as one another. There's not one best treatment. So you actually get the opportunity to choose which approach you think makes the most sense for you. But what all of these treatments will have in common is that they are brief, focused, and deliberate. So what that means is we are paying attention to intentionally treating the symptoms of PTSD. And for most people, that treatment duration is a couple of months rather than years. In cognitive processing therapy and prolonged exposure, which are two of the frontline interventions, most veterans, or actually most people, do not meet criteria for PTSD after 12 sessions, which is often 12 weeks of therapy.
That's great. So that would essentially be cured at that point.
Yes. And so the cure word, people have different reactions or thoughts about that than I do, but I would argue that we can cure PTSD.
I didn't mean to say the C word. I'm sorry. But people can get to a better place within 3 months. I mean, that's what I really want to let people know that you can actually.
Completely.
Mhm.
Life can be so different. When I think of PTSD, I think of something horrific from the past that has continued to haunt you. And that event is, for some reason, unlike the other horrible things that you've experienced in your life where you were able to move on and put it in the past. PTSD, until it's been treated, still feels very much alive and living in the moment with you. PTSD treatment does not change the fact that this thing happened. It doesn't change the fact that it was a horrible and painful experience, but it takes it out of your future, out of the present moment, and it allows it to be something that you can put behind you and move forward with your life.
So in a way, it's like it's stuck, and you're also stuck with the physical response to that high level of fear and uncertainty. And the treatment
Mhm.
pulls apart that feeling so you're not living it every day.
Exactly.
It's still a
And
memory, it's still part of your life, it's still part of who you are. Doesn't take that away. But you don't feel as
yes,
if it's constantly happening to you, which is the very, like we said, exhausting piece of living with PTSD.
right. So, I mean, you can even think about another serious physical injury that you've had. So, for example, I've torn actually both of my ACLs in my knee, and I had surgery, reconstructive surgery. I went through physical therapy, and those those interventions, those treatments did not change the fact that I ruptured my ACL. I have visible scars from the surgery. But the difference is now I can run, I can hike, I can play sports, I can lift heavy weights. I'm not really restricted. Every once in a while, there will be a ping of anxiety because I remember the injury, or I worry that I would re-tear the ACL, or maybe I step on it weird and there's some pain. But it goes from being something that is at the forefront of my attention every day, and it's holding me back from living the life I really want to live. And now it's moved into being something more of a memory, a past experience, something that's just part of my history or my background. PTSD is really similar if we treat it.
Yeah, that's a good example. So if we don't treat it, what happens? So what do you see in terms of maybe self-treatment, self-medication? What do people do to try to survive? And what are some of the consequences of not getting the right treatment at the right time?
Yeah. So obviously it really varies person to person, but some common problems that we see for people who have untreated PTSD would be a co-occurring depressive disorder, which can have a huge impact on relationships, being able to get things done, being able to enjoy life. Issues with substance abuse are also extremely common. A lot of people with PTSD initially may try to use substances to help them not think about what happened. And then over time, it morphs into this whole other bigger problem. We also know that people with PTSD are at pretty high risk for suicidal thoughts and even making suicide attempts and death by suicide. So, unfortunately, those are some of the things that we're risking if we let PTSD go untreated for too long.
Very common to see, for example, drinking to be used to help with the sleep problems that you mentioned earlier. It's a common response in adults,
Yes.
and then that becomes a problem on its own, right?
Yeah, and I'm actually personally very interested in how sleep is impacted in PTSD, and there's this funny cycle. So maybe we use alcohol to help us sleep, but what I would imagine most people have experienced is that while alcohol helps you fall asleep, you actually don't get very good quality of sleep. So you stay in those lighter sleep stages. So you actually slept through the night, but you don't feel super rested, and that fatigue then builds up. And another I think, surprising side effect when we're not getting enough REM sleep, when we're doing most of our dreaming, whether that be because we're not hitting that stage of sleep because we've been drinking, or if we're just not getting enough sleep, maybe because we're avoiding sleeping. There's actually this phenomenon called REM rebound, where our brains rather, start to push dreaming to be the most important sleep stage. So the less sleep you get, the less REM sleep you regularly get, the more your brain will start to force it to happen. And for people with PTSD, what that can mean is having more nightmares. So getting good sleep and improving sleep becomes really important in treating PTSD.
And I think it's important to talk to people. It is so common that it's really most helpful to talk to people in a very straightforward manner, whether that be a family member, a peer, someone at work, or a patient if you're a clinician. Just be open about it. It's really common. It seems like you might be drinking on a daily basis to try to get some sleep. That's understandable, but it's really it's going to make this harder to treat in the end because your body's not able to heal when you don't get that sleep, that good sleep that you were mentioning.
Exactly. And I think that the way that you spoke about that is a really helpful and effective way for anyone to speak to their patient or their loved one about their concerns, which is coming from a place of understanding of maybe why they are feeling certain things, acting in certain ways, doing certain things. It makes sense that maybe you're trying to drink to help you sleep, but it's also causing these other problems. So coming from a place of understanding, but also support, let me help you. I think those things are really important.
it's interesting to try and find safe ways to talk about it. Post-traumatic stress disorder can have its own stigma. It can feel to people like a weakness, or they're having a problem processing a normal experience. And sometimes the sleep is a safe way in, right? You don't seem to be sleeping very well. Safe sleep can be a safe thing to talk about. A lot of people that come for help, their first complaint is, "Oh, I'm having trouble sleeping." And then as you go into kind of more their experience and other things that are happening with them, it turns out to be a PTSD related issue. What are some
Yeah,
other safe ways to talk for families that maybe there's someone they're concerned about that they can bring it up or talk to them that you've discovered?
yeah. I think what's important is that it is a trusted loved one that is approaching the person who's been suffering, because chances are they're probably in a place where they don't trust very many people, or they feel really disconnected. So having someone who's not very close may not be as effective as having someone who the person currently trusts and feels comfortable talking with. And then again, I think coming from a place of understanding, I've noticed that you've really struggled since this thing happened to you, whether it was weeks, months, or years ago. I've noticed these things. It seems like you're struggling. Can I help you get? Can I help you get help? But we want to make sure that the the individual who is suffering has autonomy and the right to choose, rather than trying to force treatment or make ultimatums or coming at the person aggressively. Those things are pretty unlikely to work.
A lot of families will express a personality change, right? They're
Yeah.
different. That's the way that they experience it, is that the personality has changed. Now that what that might mean is can be a hundred different things, but I think it's okay to come up from that perspective too. You're different. You've changed. Something's different, and I think it's something that has happened. Would you be willing to get help for it?
Yeah, definitely.
Yeah. Um, so there is treatment. PTSD is very common. 20%, like you said, is very common, particularly in the veterans population.
Hmm.
There's no shame behind it. It's kind of an unnatural response to an unnatural situation that there is treatment for, that even within 12 weeks, people can be in a different place and feel better and even maybe potentially be cured. Um,
And
what are some of the barriers to seeking treatment besides those?
yeah, so I want to talk about barriers, but I also just want to say there's been some really cool research in just the last couple of years, where we have been doing what we call, well, actually, people call it different things, but intensive or masked PTSD treatment, where people can actually do PTSD treatment every day, and that would still just be for 12 days. And they get the same exact results as the people who do it over 12 weeks, but they get those results exponentially faster. Um, so that's just something really exciting that I wanted to share.
Right. Have you done much work with the eye movement type therapies?
I personally do not. That has so eye movement desensitization and reprocessing therapy,
Hmm.
EMDR. It is one of the evidence-based therapies with the top line recommendations, but it has not been disseminated for training in VA the same way that cognitive processing therapy and prolonged exposure have. So we do have providers here who have been trained in it, but I'm not one of them.
But it is considered a evidence-based, like a best practice. It might be something someone encounters if they do go for help as an
Yes,
option.
definitely. I hear often in the community that that is one of the primary treatments that people are offered if they have PTSD. And there also seems to be kind of regional variability. Different systems have different preferences, it seems.
Hmm. Right.
Um,
Are there people, is there anyone who's like inappropriate for PTSD treatment or it might not be the right fit?
yeah, so first of all, they would need to have PTSD. if we're assuming that, then really there are not very many people who are inappropriate for PTSD.
Mhm.
If someone has a manic or a psychotic related disorder, that's not even a rule out for PTSD treatment. We would just want those issues to be medicated and treated so that they don't interfere with the PTSD treatment. Or if someone is at acute suicide risk, so if they're at imminent threat to themselves or to other people, then we would not want to begin PTSD treatment. We would want to help that person out with safety planning. And once they have a firm plan that they're able to implement to keep themselves safe, then we can move into PTSD treatment. But we know that it doesn't matter what type of trauma you have, it doesn't matter how old you are, how long ago your traumatic event happened, it doesn't matter what your gender is, it doesn't matter if you've had traumatic brain injury, if you have a co-occurring substance use disorder. PTSD treatment is equally effective for all of these different types of people. And not only does it treat PTSD, but these treatments have also shown to treat depression symptoms, suicide ideation, various physical health concerns, physiological reactivity, like the startle response, the always feeling like the physical part of anxiety, and even dissociation. So there are some states when some people would not yet be appropriate for PTSD treatment. Again, if they're at imminent threat to themselves or if they have an unmedicated or an untreated mania or psychosis. But once those things have been treated and stabilized, we can move into PTSD treatment.
What is your favorite thing to say to people that you can see are sincerely struggling with PTSD? How do you get them to open their eyes to getting treatment?
Oh man, that is a good question. I have a couple of different stories. I think my favorite thing to talk to them about is so one of the symptoms of PTSD is avoidance, avoiding thinking about the traumatic event, feelings associated with it, people, places, things, conversations, situations that might trigger a memory or make them feel like they're back in that situation. And avoiding those things in some ways makes a lot of sense. Unfortunately, avoidance is also one of the main reasons that people get stuck. So, as I mentioned earlier, PTSD, the symptoms of PTSD are pretty common, but what's different is their intensity and how long they last for. So, we actually are now thinking about PTSD not necessarily as a mental illness, but rather as a disorder of non recovery. And avoidance, not allowing themselves to process or think about what happened, that is actually one of the main factors that keeps them stuck in this place of suffering. And I ask them to imagine, so if someone is coming over to your house and they're surprised you, so things aren't super clean. At my house, I have 3 dogs. They shed a lot. I would need to sweep up some dog hair real fast. But if I don't have time to clean appropriately, maybe what I do is I just kick a little bit of dirt or dust under a rug. That is all well and good if I come back later to clean it up. But if I just continue to do that every day, kick a little bit of dust under a rug, then what happens over time is that that mess starts to build up. And even though it is hidden, it's covered up by the rug, it starts to actually become visible to others. Maybe I trip over it unexpectedly because there's now a large lump, or it starts coming out of the edges. And my patients often really identify with that. What they try to do to manage their PTSD is to put it in a box and throw it away. But the longer they do that, the bigger of a problem it becomes. And they find themselves tripping over it unexpectedly. It comes up at random times and it starts to cause those other problems. And I tell them what we're going to do is we have to clean up under the rug. We're not going to just get rid of the rug. We're not going to try to do it all at once. We're going to lift it up and clean a little bit out day by day until it's all been taken care of.
Yeah, I like that. Sometimes I like to explain to people that their world is not a safe place. And I'd like to challenge that maybe their world can be safer than they think if they allow themselves to get some help and looking at things in a different way, and maybe experience more, and have relationships that they didn't think they could, and do things they never imagined they could. Just different ways to talk to people to help them understand what their current, like how they're managing things now, what's working, what's not working, and let them know that help is out there. We're
Yeah,
almost out of time, but I do want to just stress the fact that treatment for PTSD is common. There's no shame or scandal with having it. It's very treatable, and the treatment has almost no side effects, and it works.
it does work. So it's estimated that about 80% of people who finish, keyword finish, PTSD treatment don't meet criteria for PTSD at the end.
And general advice for anybody that's seeking out therapy, if it doesn't feel right, it might not be right. Sometimes it might not be a good fit, but don't let that, or a bad experience from 10 years ago, please don't let that interfere with you or your loved one trying to try again to find a good fit that you can actually work through a program like this with. Great. Well, I really appreciate all the work that you've done in development of the science and all the individuals that you've helped. It's so meaningful and it's so common, and I just think we're scratching the surface on the ways that trauma affects everyone in their everyday life.
Yeah.
Such a strong factor in the lives of our veterans that I think your focus has been so valuable and so helpful. So thank you.
Yeah, thank you. And I just want to encourage anyone who's listening, if you are a veteran, to enroll at your local VA. They will be certainly offering these treatments. If you're a civilian or for whatever reason you don't feel comfortable or unable to go to a VA, these treatments are also offered in the community. And you can Google providers who offer cognitive processing therapy or CPT, prolonged exposure or PE, or EMDR, eye movement desensitization, and reprocessing therapy. If you Google those words and look for providers in your area, you should be able to find someone.
And I think you'll be glad you did.
Yes, it's literally life-changing.
Great. And it's out there. Well, thanks again. Once again, we encourage everyone that recognizes this in themselves, someone at work or a loved one, to spread this word that the treatment out there is new, it's effective. Like I said, it has relatively few side effects, and it's worth doing.
Definitely.
Thank you, Erika.
Yeah, thank you so much for having me.